Uh, Dr. Mohammed Sheikh, the Director General, National Council Population and Development, and the Honorable Executive Committee and Board Member of Partners in Population and Development, Professor Kamarugu, Chairman Committee of Eminent Persons on COVID-19 Advocacy and moderator of the session, Mr. John Waniki, Deputy Governor, Laikipia County, Mr. Ademola Olajide, UNFPA representative in Kenya, Dr. Elia Zulu, CEO and Executive Director of AFIDEP, Professor Mohammed Rizal Dominic, Deputy for Training, Research and Development of BKKBN and Partner Country Coordinator of Indonesia for PPD, distinguished guests, ladies and gentlemen, all protocol observers, good morning and good afternoon. My name is Adnene Benhaj Aissa. I'm the Executive Director of Partners in Population and Development. I'm from Tunisia. I've been working in South-South and international cooperation for more than 25 years, since I was in the Tunisian National Board of Family and Population, Ministry of Health, and also involved in all international cooperation programs, projects, and activities conducted by the government of Tunisia in the field of family planning, reproductive health, and population. I wish to congratulate the NCPD for brilliantly organizing this timely important fourth National Leaders Conference on Population and Development under these critical circumstances caused by the COVID-19 crisis. And it's a great honor for me to participate in this event and share with you our contribution in addressing population issues at country level and achieve Vision 2030 and the SDGs through national mechanisms called South-South Cooperation National Task Force, which PPD have established since 2008 with the support and contribution of UNFPA. I wish to start first by introducing my organization, Partners in Population, very briefly. Partners in Population and Development is an intergovernmental organization. It was created in 1994 at the ICPD, International Conference on Population and Development, by 10 founding member countries, including Kenya, with the aim to institutionalize and promote South-South cooperation in the field of reproductive health, family planning, population, and development for the implementation of the ICPD program of action. So as you can see, PPD is very linked with the ICPD program. And since then, the membership of PPD has increased to 27 member countries. PPD now counts 27 countries. Most of the countries are coming from Africa. And also the framework of South-South cooperation and population and development has expanded to an increasing role for developing countries themselves. PPD has devoted itself to promoting and supporting a variety of South-South initiatives at the international, regional, inter-regional, and also national levels. The rapid economic growth of many developing countries has been accompanied by significant improvements in the development prospects of a large number of other developing countries. Several of the major developing countries are in a better position to share with other developing countries their considerable technical and program expertise, as well as their experience in health and population that they have acquired over the last 3 decades, and particularly since the middle 80s and 90s. Most important, governments are willing to put more technical and financial resources of their own to support initiatives in this field. A large number of other developing countries have also acquired valuable expertise and experience in research, training, and management of commodity security, provision of family planning and other reproductive health services, maternal health, service for adolescents and youth, sharing best practices, and also the with other developing countries will undoubtedly promote further implementation of the ICPD at 25. Distinguished guests, ladies and gentlemen, the 4th National Leaders Conference is an excellent opportunity for the government of Kenya. It's organized soon after Nairobi Summit, which was a massive success towards the achievement of the 2030 agenda, and during which the global leaders made very important commitments to achieve the 2030 agenda. It starts from the 3 0 goals: 0 preventable maternal deaths, 0 unmet need in family planning, and 0 gender-based violence and harmful practices against women and girls. More than 1,200 national commitments and the following important areas have been made. First, achieve universal access to sexual and reproductive health as a part of universal health coverage. Mobilize the required funding to finish the IPD program of action and sustain the gains already made. Draw on demographic diversity to drive economic growth and achieve sustainable development. Address gender-based violence and the harmful practices of child, early and forced marriage and female genital mutilation. And finally, uphold the right to sexual and reproductive health care in humanitarian and fragile contexts. And PPD played an important role in the Nairobi summit to incorporate South-South cooperation as one of the accelerated achievements of the ICPD, thanks to successful programs and activities implemented over the last 25 years, which resulted in improving population policies and reproductive health programs, not only in its member states, but with other developing countries, and which was made possible through advocacy, capacity building, knowledge sharing, and technical assistance and transfer of technology. It was clear for PPD that in order to further strengthen South-South cooperation at the national level, we need to work with our honorable board members and partner country coordinators in the member states to involve on a regular basis officials from other concerned ministries. Coordination with key ministries, UN agencies, parliamentarians, academia, and other national actors is always required to institutionalize South-South cooperation and engage the member country regionally and internationally. Distinguished guests, ladies and gentlemen, South-South cooperation and global solidarity have proven to be best opportunities in the fight against COVID-19 pandemic. The Buenos Aires outcome document adopted in 2019 at the BAPA conference BAPA plus 40 conference recognizes the contribution of South-South and triangle cooperation in promoting gender equality and the empowerment of women and girls in sustainable development. This is also why the response to and recovery from COVID-19 pandemic needs to be carried out with the gender lens, ensuring sexual reproductive health and rights, promoting gender equality, and protecting people from gender-based violence and harmful practices, and more specifically women, girls, and youth who are the most vulnerable. Providing family planning and other sexual reproductive health positive impact on maintaining systems up and running. Chinese donation of personal protective equipment, as China is a leading member country of PPD to African countries, is an example of solidarity between developing countries when there were huge constraints on production system and participation among countries to get those protective and life-saving resources. At the Nairobi summit, the session on South-South and triangle cooperation reminded delegates the promise taken in 1994 that South-South and triangular cooperation is the alternative political and financial tool in developing countries for achieving unfinished ICPD and SDG 2030 agenda. If countries accelerate progress after Nairobi in the framework of COVID-19, we therefore need to accelerate commitments and intensify South-South cooperation financing mechanisms. In this global effort, PPD and UNFPA jointly committed to work in PPD member countries and review the progress of Nairobi Summit national commitments and evaluate the country's initiatives to meet the national commitments taken at Nairobi. In fact, we wanted to know from our member states what were the challenges faced and what solutions found to implement the national commitments. And the National Task Force endeavors to enhance South-South cooperation in the field of population, reproductive health, and development. This task force will work as a platform to bring together policymakers, UN agencies, NGOs, CSOs, resources, and private entrepreneurs to engage in a thoughtful public dialogue and cooperative efforts. The existing Committee of National Task Force in our member countries comprises between 14 and 16 members, chaired by the PPD board member and coordinated by the partner country coordinator. In 2020, we have strengthened National Task Force in 10 PPD member countries, starting Bangladesh, Morocco, Thailand, Zimbabwe, Nigeria, South Africa, Indonesia, Benin, Uganda, and Kenya. The selected 10 countries' situation and progress on Nairobi Commitment revealed that despite COVID-19 pandemic, which affected the country's economy and health sector, the governments of these countries put great efforts to contribute in the achievement of the Nairobi commitments. Global solidarity is vital. South-South and triangular cooperation is crucial in the success of future initiatives to fully realize Nairobi commitment and the SDG by 2030. And I wish to share some of the recommendations which were highlighted in the reports we have received from the 10 member countries. We are preparing a report which will be published very soon. From the reports, we have concluded that the constitution of 3 subcommittees at national level to deal with is one of the recommendations highlighted in most of the reports. First, to upgrade population policy highlighting Nairobi Summit commitments and demographic diversity and demographic dividend, maternal deaths, unmet needs for family planning and gender-based violence. And number 3, financing to finish the ICPD program of action and sustain the gains already made. Number 2, we have seen that the task force members strongly recommended that to achieve Nairobi commitments, there is an urgent need for more effective national coordination, mobilizing additional domestic resources, establish win-win partnership with development sectors, including UN agencies, and promoting South-South and triangular cooperation. For Kenya, I wish to say that a good progress has been made towards the implementation of the 17 commitments taken at Nairobi. And I wish to congratulate the Director General, the partner country coordinator, and all colleagues in the NCPD for exemplary collaboration with PPD. We plan in 2021 to partner with UNFPA and review progress of the Nairobi Summit commitments in other PPD member countries. And in conclusion, I would like to reiterate my sincere appreciation to the government of Kenya and the National Council on Population and Development for giving me this opportunity to bring our contribution to the success of the 4th National Leaders Conference, graced by His Excellency President Uhuru Kenyatta. Hope that the outcome document of this conference will highlight the role of South-South cooperation in population and development in the Kenya, and I'm confident that the country is ready to be designated as Center of Excellence in population-related matters. Thank you very much for your attention and wish you success in the conference.